My name is George du Toit. I'm a pediatric allergist at Guy's and St Thomas's Hospital and the Evelina Children's Hospital. I've been asked to speak to you about the question of introducing nuts to your diet as a mother whilst pregnant and whilst breastfeeding. So let's deal with pregnancy first. This is a controversial field within the literature, as there are no randomized controlled studies, so no rigorously designed studies where patients are randomized to one group or the other. And that's the way you really answer this question. There are lots of cross-sectional studies, so these are weaker in design, and there are many of these throughout the world, some of which have been done at this hospital. And these find in either direction. Some find for the increase of risk through consumption in your diet during pregnancy, and some find against this. My opinion, after having reviewed this literature, is that you're better off consuming nuts. And nuts are also extremely nutritious. So there are two questions. You need to look after maternal nutrition as well as the nutrition of the fetus while pregnant and the newborn after birth. What I would encourage, and I do in clinic for families, is that don't take a middle-of-the-road approach. If you wish to avoid nuts, avoid them fastidiously, which is actually quite hard to do because nut protein is ubiquitous in the environment. If you're going to consume nuts, then do this frequently, at least 3 times a week, and a broad array of nuts, but always to include peanut, cashew, walnut, some of the more common tree nut allergies. Once your baby is born, in at-risk scenarios, and indeed for most children, you only have 2 options, is to eat nuts or avoid nuts. Again, the literature is slightly mixed, and the one randomized trial that looked at this question showed that if diets are over-restricted, the study also included other allergens, but there is a risk of fetal malnutrition, maternal malnutrition. So you need to make sure that if you're going to restrict diets, certainly beyond allergens, even beyond nuts, so egg and milk, you need to be under the care of a dietitian to do this. What about introducing nuts early on during breastfeeding? Will you reduce the rates of allergy in the offspring? Well, again, this has not been shown, and there are soft studies in both directions. But my bias and what I tell families within clinic is to do this, to take this up as long as nobody else is allergic to this, and to do it frequently, around 3 times a week. Then, if your young baby develops eczema or egg allergy or milk allergy early on in life, I would rapidly get the baby tested, and if the tests are negative, there is an intervention available, a very simple intervention, and that's introducing nuts to their diet to prevent, at least this has been demonstrated for peanut, and we'd like to think that this can be done for other nuts as well. So in summary, sit down with your family and decide what your risk strategy will be. If you're very fearful of introducing nuts, then avoid nuts and make sure that other family members do so. So the home environment is devoid of nut protein. If you wish to consume nuts, do so frequently, at least 3 times a week, and enjoy this both during pregnancy and whilst breastfeeding. Whilst breastfeeding, if your young infant starts developing eczema and you are worried that a nut may be influencing their eczema, in other words, after you've eaten this, you notice eczema flares within a few hours, or the baby develops some colic and is sick after eating nuts, then obviously remove this and get your baby tested. If those tests are positive, then you've unfortunately lost the battle with regards to prevention. If those tests are negative, this represents an ideal opportunity to introduce some nuts to the diet to prevent nut allergy in your offspring.